Have you been told that you have hypothyroidism? Maybe you're experiencing symptoms like fatigue and weight gain, brain fog and constipation, despite being on medication like levothyroxine, Synthroid, or Armour or NP thyroid. That might be because you have an autoimmune condition called Hashimoto's and not just hypothyroidism. Let's talk about the differences between these two things and what it means for you and getting you better. Welcome back to the RedRiver Health and Wellness channel, where I help you decode your blood work so that you can get to the root cause of dis-ease and start managing it without medications. I'm Dr. Arts. Let's get started. Let's start with, what is hypothyroidism? Hypothyroidism means that your thyroid is not keeping up with hormonal production to maintain normal physiologic function in your body. Thyroid hormone is important for every metabolic process that happens within your cells. It stimulates your cells to do their job. If we don't have enough thyroid hormone, we can feel a lot of things like fatigue, brain fog. Maybe we're experiencing weight gain because our metabolism has slowed. Hypothyroidism can come from a variety of different places. It can be due to an autoimmune disorder that has caused destruction of thyroid tissue. That's an important distinction to make. Hypothyroidism and autoimmunity, like Hashimoto's, are actually two completely different things. You can get hypothyroidism from a viral illness, something called viral thyroiditis, where there's a swelling of your thyroid. And if it isn't kept in check, you can actually end up with enough thyroid damage that your thyroid does not produce hormone the way that it should. Hypothyroidism can come from a pituitary problem in your brain, which is a little bit more rare. And we can also have some cancers associated with the thyroid, which are just as rare as well. The definition of hypothyroidism can vary greatly depending on who you talk to. I consider hypothyroidism when I've looked at the entire feedback loop of someone's thyroid hormones. How is your brain communicating with your thyroid? How much hormone is your thyroid putting out? And then is that thyroid hormone getting converted into its active form? There are a lot of things along the way that can actually block that process from happening. So I would consider someone to be subclinically hypothyroid if anything along those lines is causing them to have a decreased amount of active thyroid hormone. The lab that you went to, your insurance company, and perhaps even your endocrinologist may have different ideas of what constitutes hypothyroidism. They may only be looking at one blood marker, something called TSH, also known as thyroid stimulating hormone. If you only use TSH to evaluate someone's thyroid, you are missing a lot of things that can go wrong along the way. We never want to manage someone's autoimmune condition or medication just by looking at their TSH values. Let's dig into some common symptoms that you may experience with hypothyroidism. You may experience some things on the outside. Maybe you're noticing that your skin is more dry. Maybe you're really fatigued. Maybe you have headaches or constipation. Maybe your brain doesn't seem to be firing as quickly as it used to. Some things happening on the inside as a result of your hypothyroidism that you wouldn't think of. If we consider the fact that thyroid hormone is responsible for cell metabolism of basically every cell in our body, then we have to consider the effect that it will have on things like our cholesterol, things like detoxification from our liver, on things like how quickly we can metabolize and clear out certain medications. What about what's happening with your blood sugar? That can vary greatly. You can find yourself going through really high highs and really low lows with your blood sugar. We can see adrenal damage, insufficient production of things like cortisol. We can see insufficient production of sex hormones. We can see a lot of digestive issues that are happening on the inside that you may just be noticing on the outside as it's unpredictable if I react to a food. Well, that might actually be a sign of food sensitivities, and those sensitivities could be coming from a place of physiology. If you don't have enough thyroid hormone to stimulate all of the things that your cells in your body need to do, you're going to start to notice a lot of nutritional deficiencies and inefficiency when it comes to digestion. Doctors can be really confused by your symptoms when you come in. You may go in telling them, I'm really fatigued, doc, and I have some joint pain, and I'm also very constipated. And those three things look like they're completely unrelated. Your doctor may say, well, your TSH looks fine. You're on the right dose of your medication, so it must be all in your head. Well, you know, and I know that that is certainly not the case. If thyroid hormone is touching on every metabolic process in your body, it's really important that we check in on that active hormone, that T3, which not a lot of doctors are testing for, if we're going to find out if you have something called subclinical hypothyroidism. This is much more common than an overt hypothyroidism, and it's much harder to catch if you don't know what you're looking for. So how do we treat Hashimoto's? How do we treat hypothyroidism? You may be wondering, how do you treat my hypothyroidism without medication? My doctor told me that the only option for me is to go on something like levothyroxine, T4. Well, the way that we treat hypothyroidism may be very different than the way that we treat autoimmunity. Again, they're mutually exclusive. You don't always have hypothyroidism when you have Hashimoto's or autoimmune thyroid disorders. So let's talk about the different kinds of autoimmune thyroid disorders that you can have, and then how they can cause something like hypothyroidism and why that can't be managed just with medication alone. So the different types of autoimmunity that we can have are Hashimoto's, Graves' disease, and then one that doesn't have a fancy name called thyroglobulin antibodies. Thyroglobulin antibodies tend to be positive in patients who have Hashimoto's. It's pretty rare to just have positive thyroglobulin antibodies, but people with Hashimoto's don't always have positive thyroglobulin antibodies. Let's talk about the difference between those two autoimmune diseases. Hashimoto's means that you create something called thyroid peroxidase antibodies. Thyroid peroxidase is responsible for activating your thyroid hormone. So when you create an antibody against this particular enzyme, you can actually cause a lot of destruction of thyroid hormone before it gets activated. In other words, T4 does not become T3 as quickly or as efficiently as it should. Thyroglobulin antibodies do something a little bit different. And again, not everyone who has Hashimoto's will have thyroglobulin antibodies. Thyroglobulin is actually the protein, globulin is a protein, is the protein that carries T4 around your body. It inactivates the thyroid hormone, and it allows it to kind of be shipped around, going into each organ, each cell that it needs to. When you create an antibody against something like thyroglobulin, what you're doing is attacking the ship that's carrying thyroid hormone around your body. So we can end up with lower thyroid hormone than we should, even though your thyroid is actually keeping up with production. This is why it's so important to check all along the entire feedback loop from your brain all the way out to your organs, all the way to T3, making sure that nothing is happening along the way. If you have these autoimmune conditions, you can be sure that if we haven't identified what triggers them, you are destroying not only thyroid tissue, but thyroid hormone as well. Now, Graves' disease is a little bit different. With Hashimoto's and thyroglobulin antibodies, you can actually go through hypo and hyper swings. Graves' disease we tend to think of as being only hyper in nature, but you can actually have all three of these autoimmune disorders at the same time, which means you can also be swinging from that high place of hyperthyroid to that low place of hypothyroid. In Graves' disease, there is something that is stimulating your thyroid to continue to produce more thyroid hormone. That's why you often end up in a hyper state. What happens when we over-medicate someone with a drug to help reduce the response from their thyroid when you have Graves' disease is we can actually throw them into a hypothyroid flare. This shouldn't happen, but it does, because we don't often see patients for another 3 or 6 months after we give them these medications. That's a little different than the way that I work with my Hashimoto's, Graves' disease, and thyroiditis patients. I want to make sure that if we're putting you on a medication, we're continuing to test along the way. So how does modern medicine treat any one of these autoimmune diseases that we just went over? Traditionally, you're going to be given something called T4, also known as levothyroxine. Synthroid is another example of this. T4 is inactive thyroid hormone. When we give a patient T4, we are relying on their body's own ability to convert T4 into active thyroid hormone, which is T3. The problem is there's a lot that can go wrong along the way, especially if you have a lot of nutrient deficiencies, as that conversion requires an abundance of vitamins and minerals to happen. This is one of the reasons why many people taking T4 may still be having a lot of those hypothyroid symptoms that we've talked about. If your body is inefficient at converting converting T4 to T3. We can give you all the T4 in the world, and it's not going to make a difference. If all we're looking at is that feedback loop and we're checking out your TSH, which is your brain hormone, and looking at that lab range and saying, well, TSH is within normal range, so I'm not going to give you any more or less of your medication, we're really doing the patient a disservice. We have to make sure that we are checking what your conversion rate of T4 to T3 is before we know if you are able to actually function normally within a healthy range. Some other ways that your doctors may traditionally try to treat an autoimmune thyroid disorder might be with things called immunosuppressants or steroids. This basically dampens your own immune system's response so that it cannot continue to attack itself. The problem with that is pretty obvious. We need our immune system every day. Everything that we're exposed to requires us to have a strong and healthy immune system. Unless you don't plan on leaving your house very often, taking an immunosuppressive therapy for something like an autoimmune condition like Hashimoto's or Graves' disease is actually not your best option. We can manage autoimmune flares by identifying autoimmune triggers, but that is unique for each patient. Now, in a case of Hashimoto's or Graves' disease or having these positive thyroglobulin antibodies, is there ever a situation where you would need to go on thyroid hormone? Absolutely. If you've had these diseases for long enough, or if you've triggered those flares severely enough, you can end up with less and less thyroid tissue. Inevitably, this is going to lead to a hypothyroid situation. Our thyroid, unfortunately, does not grow back, not like our liver. So as much as we reduce inflammation after something has happened, the chances of actually getting full function back out of your thyroid are pretty low. If you actually need thyroid hormone because you are truly hypothyroid, we have to make sure we get those levels stabilized. It will always be a part of your treatment. We need to make sure that your body has everything that it needs to function normally while we work on identifying what the triggers are for those inflammatory responses that cause continued destruction of your thyroid. In a lot of my Graves' disease patients, even children as young as 6 and 8 years old, one of the recommendations that you're going to get from your doctor or the hospital, depending on where you are at the time, is going to be some kind of surgical procedure to kill the thyroid or remove it altogether. If you have Graves' disease, one of the recommendations you may have been given is to just kill or remove your thyroid altogether. This represents such a misunderstanding of what autoimmunity truly is. If you're in a hypothyroid flare, assuming you have enough thyroid tissue to keep up with hormone production, you will come out of that hypothyroid flare as well. These are called flares for a reason. This is not a permanent state of being. I've had 6 and 8 year olds in the hospital and their parents calling me saying they want to take my kid's thyroid. And I'm like, hold the phone. There is so much that we can do. Give us some time and we can reduce the flare symptoms and get your hormones under control, usually without medication, but we use it when we have to. Point of the story being, don't let them take your thyroid, at least not until you have a specialist looking at your case and making sure that this isn't fixable in some other type of conservative way. Why wouldn't that have been recommended to you to begin with? To be honest, they just don't really know. Autoimmunity it's kind of a hole in our Western medical system. It's really poorly understood and thus it's very poorly managed. Here's something that I really want to drive home with you guys. All of us think thyroid iodine, and that's true. We need to have iodine in order to create thyroid hormone. In fact, the difference between T4 and T3 is actually just one iodine molecule. Thyroid peroxidase removes an iodine molecule from T4, turns it into T3. So yes, of course, we need iodine to create our thyroid hormones. However, because many people who have Hashimoto's are creating an antibody against that enzyme that targets iodine. If you take high doses of iodine, anything over 100 micrograms, you are actually putting yourself at risk of a flare. So just because you have hypothyroidism, just because you have Hashimoto's does not always mean that you're a good candidate for iodine. It's always important to consult your physician or your specialist before you're starting any kind of new supplement. This doesn't just apply to medications. True iodine deficiency in the United States is actually very rare. So what is Hashimoto's thyroiditis? What are doctors even looking for when you get something like an ultrasound or a biopsy? So thyroiditis means inflammation of the thyroid. Anything with itis at the end of it is going to be inflammatory. When you have Hashimoto's thyroiditis, what that means is that your body is creating a lot of inflammation in your thyroid. This is an autoimmune attack. So this is your body attacking itself. But we can actually get thyroiditis from a viral infection as well, which is pretty common and not something most people know happens until they get something like a thyroid ultrasound. Now, you may have been told that you have thyroid nodules, and I'm sure this was really scary. If you start Googling thyroid nodules, you're going to come up with all sorts of answers about what those could be. I am here to tell you that thyroid nodules are actually really common, and most of the population has them. They form when we have an inflammatory reaction in our thyroid. So say you get a virus, your body has to produce a lot of thyroid hormone to help fight that viral infection. So you may end up with some transient swelling in your thyroid. Anytime you have an inflammatory process, this applies anywhere in your body, you're going to create cell reconstruction. Those cells are going to continue to redefine themselves to withstand the inflammation, the attack from your immune system. When that happens, they can actually create little nodules. This is just tissue that has overgrown as a result of that inflammatory process. Can it become cancerous in the future? That's actually really rare, and it's something that we can tell through a very simple biopsy. Although when nodules are small enough, they generally don't meet the criteria to be biopsied anyway. So if you've been told that you have nodules on your thyroid, first and foremost, it's probably not the reason why you have a hypothyroid or hyperthyroid situation. It's not the reason why you have autoimmunity. If anything, it is a result of the autoimmunity, and it certainly doesn't always mean cancer. Those are very few people end up having cancer. So assuming that your thyroiditis is not due to a viral condition, what could be causing it in someone who has Hashimoto's? Is it present all of the time? Yes and no. So that inflammation is going to be present all of the time if you're doing something that is triggering the inflammatory response. We've talked about how this is unique from patient to patient, but I will tell you there is one thing that absolutely triggers an inflammatory response in those people who have Hashimoto's, and that is gluten. I'm sorry, I know that's a hard thing to hear, but people with Hashimoto's should stay away from gluten. Gluten on a molecular level actually looks almost identical to thyroid peroxidase. Your body, if you have Hashimoto's, is creating an active antibody response against thyroid peroxidase. If you eat gluten, the second it gets out into your bloodstream, your body is going to go on the attack. It's going to think, look at all of this thyroid peroxidase out in circulation. We hate you. We're going to neutralize you as soon as possible. You're going to end up with big flares when you eat gluten. You may be in a long flare right now, so maybe you don't notice those differences as much, but if we were to do an elimination diet with you and reduce inflammation with supplements and lifestyle changes, you would notice if you ate gluten. It would be pretty obvious. So if gluten isn't okay with those with Hashimoto's, what about other kinds of foods? In general, there is no blanket statement about diet for people with Hashimoto's. Other than gluten, those dietary triggers are actually going to be very unique from person to person. This is not a situation where no one should be eating dairy or soy or eggs or nightshades or, low FODMAP or whatever it is. This is not one of those cases. With autoimmune conditions, and this applies to all of them, the triggers for people are going to be very individualized. So those who have a Hashimoto's thyroiditis, what that means is that your thyroid right now is triggered and it's inflamed. That is usually a transient state. If we can identify what's been triggering that and remove those things from your life, we can actually reduce the thyroiditis. So the swelling in your thyroid will go down. A lot of people think Hashimoto's thyroiditis is a permanent state, and that's not true. If you are flaring, you're flaring. There's going to be a start and there's going to be an end. And that gives us a lot of information in between about what we can do to help reduce that response in your body. How can a thyroiditis lead to hypothyroidism? So if itis means inflammation, what we're really talking about is your immune system sending cells to the area that have been flagged by these antibodies. Your antibodies have stuck all these little red flags in your thyroid. And now you have white blood cells that are being attracted to the area. They're like, we hate red flags. We're going to release all of our inflammation, all of our enzymes, everything we can, everything we have. We're going to bring to those red flags because the body has told us it's bad. Now, these are things that normally happen when you're exposed to viruses, right? But when you have autoimmunity, this is a reaction that's occurring in your body every single day if we haven't identified what the triggers are. So how do you end up with hypothyroidism when you have all of this inflammation? When a type of white blood cell called neutrophils comes to the area, the types of enzymes that they release to neutralize those red flags, that thyroid peroxidase in this case, if you have Hashimoto's, when neutrophils come in and they release all of these little granules, all of these inflammatory proteins and enzymes, those proteins and enzymes actually destroy thyroid tissue. They cause it to do something called necrose. It literally dies. It gets kind of liquefied, it's gross, and it dies, and it doesn't come back. That's how you end up with hypothyroidism. It isn't that your thyroid is just lazy. It isn't that your brain isn't telling your thyroid to produce hormone. In fact, what it is your thyroid's getting the signal, but it doesn't have enough tissue to produce enough hormone for you. Let's talk about thyroid labs. I want to make sure that we work our way through the feedback loop so that you feel prepared when you go in to meet with your doctor and they're recommending a change in your dose or perhaps a new or different medication. Most of you have seen the value called TSH. Let's talk about what TSH is and let's talk about what it isn't. TSH is thyroid stimulating hormone. This actually comes from your pituitary gland in your brain, and it tells your thyroid to produce thyroid hormone known as T4 or thyroxine. So thyroid stimulating hormone comes from your brain and tells your thyroid to produce thyroid hormone. That means that TSH is not a thyroid hormone. So if that's the only thing that your doctor has been testing to manage your medication, they're missing a lot of pieces along the way. Now, some doctors will test for TSH and T4. That's that inactive hormone that's being produced from your thyroid when your brain tells it to. T4 is helpful. It lets us know how much thyroid tissue you have, because if it's responding to your brain, that's a good sign. That means you've got enough thyroid tissue and you've got a good link between those two things. But even measuring for TSH and T4 is not enough if you want to know whether you have something called subclinical hypothyroidism. We have to go further. We need to look at what T4 gets converted into. T4 goes to two places. It goes to something called reverse T3 and total T3. Now, reverse T3 is something we test all of our patients for because if you have a high reverse T3, it can cause hypothyroidism. Since this is something that not a lot of physicians are testing for, again, a piece of that feedback loop gets missed. You're still hypothyroid and nobody is doing anything about it. Reverse T3, when it's high, is usually an indication of high stress. Most of the time, it will correlate with a high cortisol level or a high DHEA. So what happens to T4 when it doesn't go to reverse T3 is it goes to something called total T3. Total T3 just means it's bound to a protein and it is inactive. T3 has to be taken up by the cells of your body. So we actually test for something else when we look at your thyroid, and we test for something called T3 uptake. T3 uptake is an indirect measurement of how many receptors are available for that T3 hormone. Again, there are so many things that can block those receptors and prevent T3 from binding and make you feel like you're hypothyroid, even though on paper your levels seem to be fine. We test for T3 uptake and we test for reverse T3 because there are things that can go wrong along the way when T3 is on its way to bind to the receptors in your cells. Once T3 is bound, it then gets converted into something called free T3. Free T3 is something that I have seen some physicians test for. It's even something that I was taught to test for when I went to school. In fact, free T3 is actually mostly inside of your cells, inside the cells of your organs. So it's really difficult to get an accurate picture of that through blood work. Instead, what we want to look at is TSH, free T4, total T3, reverse T3, T3 uptake, and then all of the different kinds of thyroid hormones that we're testing for as well. That is the only way that you are going to get an accurate picture of whether your hormones are working if you are on medications or whether your thyroid is working in general. What are the options other than T4 medication, other than levothyroxine, other than Synthroid? The other options are things like desiccated thyroid, which doesn't fit every case, and we would add something like T3. The brand name of that is Cytomel. T3 is very metabolically active in your body. You may be wondering at this point, well, why don't they just give me T3 if T3 is my active hormone? T3 only has a half-life of about 4 hours. So if we gave you T3, you'd be dosing it pretty much all day long. What's nice about giving someone T4 is we allow their body to make the choice of when they want to make those conversions. But we have to make sure that you're making those conversions efficiently. Sometimes it's a little bit of a chicken or the egg situation. Are we poor in our nutrients because we have low thyroid hormone? Or do we have low thyroid hormone because we were poor with our nutrients? Sometimes we have to provide help along that entire cycle before we can get an accurate picture of what the root cause of your dis-ease is. So where did my autoimmunity come from? You might be wondering, why in the world do I even have an autoimmune condition? And is it genetic because my mom has it and my sisters have it and my grandmother has it, or maybe your dad has it, right? So all of us really wonder often, are these autoimmune diseases, Hashimoto's in particular, are they genetic in nature? That's such a big conversation, and it's one that I really enjoy having with patients, but it can get pretty complicated. It's not as simple to say, well, my mom had Hashimoto, so she passed down the gene for Hashimoto's. It actually doesn't work that way. Autoimmunity is a loss of self-tolerance. Our body creates antibodies all of the time. These aren't bad guys. These are really important parts of making sure that we can function in the world without being sick all of the time. But what happens with autoimmunity is we lose something called self-tolerance. Your body now starts to create antibodies against your own tissue, against things that are commensal, things that are supposed to be there in your body. Why that change happens isn't as simple as I have the gene for Hashimoto's. There is no gene for Hashimoto's. What's actually happened is as your body is creating these antibodies and sending these signals, along the way it forgot that it wasn't supposed to be attacking itself. This change actually happens on something called an epigenetic level. When we mapped out the genome, we were so excited. We were like, look at all these genes. We know every single one now. We know what all of them do. This is such a huge advancement for mankind. And then just a few short years later, we realized that there are genes on top of genes on top of genes. And we call these epigenes. These are our epigenetics. Epigenetics is actually where we're starting to see the cause of things like cancers and autoimmune diseases. Epigenetics are kind of like light switches. If you have your entire genome mapped and then imagine little light switches on top of every single one, that's epigenetics. So what controls these light switches? Something called methylation. Methylation is another really complicated thing that even doctors don't love talking about or learning about in school, so I'm not going to go too deep into that. But methylation is what's responsible for basically babysitting and managing your DNA, reading your DNA, and it happens mostly in your liver. Methylation has a lot to do with your B vitamin status. It has a lot to do with whether you have something called an MTHFR mutation. And all of those are things that we explore with every single one of our patients. Now, knowing the cause of your autoimmune disease doesn't mean that we get to fix it. We can definitely help you to get in remission. But once these genetic changes are made, at least for now, we aren't really able to reverse that, unfortunately. Can autoimmunity come from other places? Absolutely. I see a lot of patients who have activated autoimmune conditions following certain vaccinations, particularly the COVID vaccine. vaccine. Vaccines can really weaken an immune system, but you have to have already been primed for that autoimmune disease. It's not like getting a vaccine gives you autoimmunity. You have to have already had kind of those weak genes before that happens. Other reasons we can end up with autoimmunity can actually have a mental emotional root. I've seen a lot of trauma cause a lot of autoimmune conditions, not just autoimmunity, but a lot of conditions, cancers and things in general. It's one of the reasons why we work so closely with a neo-emotional release practitioner. The only way to get a patient better is to look at them from a completely holistic perspective. Dis-ease in the body is never one isolated cause. It's always going to be a combination of mind, body, spirit. So if you have hypothyroidism, and it is just purely hypothyroidism, and this does happen, it's pretty uncommon, but I do have patients who just have hypothyroidism and no autoimmunity. That is something that we can just manage with medication. And if you just have hypothyroidism and you know that it's not Hashimoto's, you don't have to follow the gluten rule. You would be okay to have gluten as long as we know that it isn't causing other types of inflammation in your body. So managing hypothyroidism when it's just hypothyroidism is usually pretty simple. Managing hypothyroidism as a cause of autoimmunity is a twofold process. We have to get your hormones regulated, but we also don't really know what your hormone status is until we manage the inflammatory flares that are coming from that autoimmunity. The way that we manage that is by identifying triggers. This is where treating the whole person really comes into play. Triggers are not just going to be dietary. You are going to have environmental triggers. You are going to have emotional triggers as well. One of the reasons why we see our patients every single week is so that we can work closely with them to understand their body and understand their triggers. We're learning about you and your body so that we can help teach it back to you. Speaking about root cause, I've created a free guide all about Hashimoto's and thyroid health. It covers this topic in detail with actionable steps that you can take right now to feel better. The link is in the description, so be sure to grab it. If you're tired of not feeling yourself, and if you're tired of going to doctors and having them tell you that everything is fine, it's definitely time for an upgrade. I don't want you thinking that it's normal to feel this way just because you've always felt this way. That's where we can help. RedRiver Health and Wellness specializes in patients just like you. We particularly specialize in Hashimoto's and the way that autoimmunity can affect your life. We create personalized care plans for every single one of our patients. We work closely with you, your doctors, and your family, if you wish, to make sure everyone is on board with supporting you on your journey forward. Click the link below to schedule a consultation with us and take the first step forward toward feeling better. If you found this video helpful, make sure to click the next one, where I go over thyroid health and common misconceptions. Click on the video on your screen right now. If you're curious about how diet can affect your Hashimoto's, be sure to click this video next, where I share the best and worst foods for thyroid health. I'll see you there. I want you to always remember that this is your body, and if something doesn't feel right, don't do it. If you think you need a second opinion, you deserve one. I want you to understand how to read your blood work so that you can advocate for yourself every day.